the secret bottom line thing in plastic surgery was if you're taking something away, it's way easier than when you're adding to or trying to change the form of something.
That's right.
I think you taught me that early, and that's a guiding principle. But I want to back up just one second. Talk about that brow lift that you guys are doing, because we're not. It's been recently. I've done a couple, but the classic coronal brow lift, which is an incision across the top of the head, ear to ear, to really lift up on things, is way out of style. It's kind of
big scar,
talk
big
about
recovery.
What you want to do now.
Yeah. So, well, you're facile with an endoscope. I'm
even
not.
That's kind of getting out of style.
Yeah, and you're limited on the foreheads you can do it on. You need a shorter forehead, not a big, big curvature to the forehead. So you're kind of limited on your patient selection there. There's this famous ENT head and neck facial plastic surgeon who's trained with an endoscope but developed this new technique.
Endoscope's like a gallbladder.
Endoscope, it's a little camera
so
device.
You're looking at the anatomy,
exactly.
but you're not making a big incision.
Exactly, but it's not a bent camera, it's not a curved camera, it's a straight camera. So again, you're limited on some of those anatomic differences. This guy developed this new technique through 3 or 4 total, small centimeter to centimeter and a half incisions, essentially elevating the whole brow, reshaping the brow, really giving someone a youthful look back with minimal incision, minimal healing, but his results are pretty astounding. Dr. Thomas and I, Steve and I in the operating room 2 weeks ago.
2 weeks ago.
Yeah, it was his idea. He told me about this procedure, kind of mentioned it to me. I found it on the website.
I
know, it's awesome.
Now, does that brow lift get you out of the realm of neurotoxin like Botox?
Yeah,
it does.
Yeah, because you're dividing a lot of the muscle, so you're essentially eliminating. You don't have to worry about paralyzing it with a chemical, neurotoxin.
Routinely, again and again and again.
Repeatedly, you're permanently dividing that muscle and weakening it.
But see, interestingly, so in my opinion, tell me about your how you divide this up too. I'm very interested in the concept of a little lateral brow lift out to the side, skin only lift, and I say to people, but the neurotoxins work so well, we're still going to be interested to treat the 11 lines and stuff like that, because for a lot of people, that's like getting your hair done. I mean, it's just a simple thing.
It is. It is a simple thing. I believe that, as you know, we really have gone away from those big lift your scalp up type things. Matter of fact, when people would ask me, but I wouldn't tell them about it, and we've mentioned that before, I'd say, it's a big incision and leave it at that. Because if they heard exactly how you did it, they wouldn't do it. I do like any of the limited incisions in the lateral brow to take care of that brow. And we don't really want to have a deer in the headlights look. You know that. We want to have something that's subtle. We just want to have that lateral brow up. The harder part's the medial brow, inside right here. And there's probably a time when, aside from just flipping the head scalp up and looking at those muscles and cutting them, we're still going to have to use neuromodulators like Botox and Dysport and Xeomin.
It's not as popular to go through an eyelid incision and go up and get that muscle.
I've tried that.
I mean, it's hard,
and it doesn't work very well.
It
doesn't last. It's just, I've tried it many times, and it's satisfactory but not perfect. Okay. So, and if it's not perfect, why would I keep doing it?
Right.
I don't want to do it.
Cheers.
Cheers.